topic is menopause. Menopause is the time in life when monthly periods naturally stop. At this time, the ovaries stop releasing eggs and stop making the hormones, estrogen and progesterone. Menopause usually happens between the ages of 45 and 55. The average age is 51. Menopause does not happen all at once. It is a transition that may take years. It may cause symptoms in some people that may be difficult. There are treatments that can help with the symptoms. The beginning could be when the symptoms or the menstrual period starts to change. Some people may have periods more often or less often than usual for that person. For example, every 5 to 6 weeks instead of every 4 weeks. Have shorter periods than before, skip one or more periods, have symptoms like hot flashes. If the person has had a hysterectomy, but the person still has the ovaries, the person may still develop menopause symptoms. Some people have no symptoms of menopause. Most people will have one or more symptoms. It could be hot flashes. Hot flashes feels like a wave of heat. It starts in the face and chest and then moves through the rest of your body. Hot flashes usually start before the end of the period. When hot flashes happen during sleep, that is night sweats. They can affect a good night's sleep. Sleep problems. During the transition to menopause, some people have trouble falling or staying asleep. Vaginal dryness. Menopause can cause the vagina and tissues near the vagina to become dry and thin. This usually starts a few years after menopause. It can be uncomfortable and it can make sex more painful. During the transition to menopause, many people start having symptoms of depression or anxiety. Depression symptoms include sadness, losing interest in doing things, sleeping too much or too little, trouble concentrating or remembering things. Estrogen is important in brain function. If you get frequent headaches or migraines, these might get worse. Some people have joint aches or joint pain after menopause. Many of these symptoms may get better after menopause. Some people may continue to have hot flashes even for years afterwards. When do you need to see the provider? If you're having any symptoms, like for example, inability to sleep, you may want to see the provider for help with. If you're having trouble working because of hot flashes, if you feel sad or down, you might want to see someone who specializes in women's health. There are treatments to relieve the symptoms. You may also need to see a provider if you have a period more often than every 3 weeks, have heavy bleeding during a period, have bleeding or spotting between periods, have been through menopause, meaning having gone through 12 months without a period, and then start bleeding again, even if it's a spot of blood. There are tests that may help the provider to tell and help if the person is going through menopause. Regarding pregnancy, as long as the person is still having periods, they can become pregnant. There are treatments that help to relieve symptoms. Treatments for hot flashes include hormone therapy. The hormone estrogen is the most effective treatment for menopause symptoms. Most people would need to take estrogen combined with progesterone. If the person has undergone a hysterectomy, they can use estrogen by itself. These hormones are safe and effective for most people. However, it is important to discuss the individual situation with the provider. There may be people that cannot and are not candidates for hormone therapy. You cannot or should not be on hormones if the person has had breast cancer, a heart attack, a blood clot, or a stroke. Some types of antidepressants can ease the hot flashes and depression. They are usually used in people with a history of breast cancer and cannot take estrogen. One of the medicines that is used to prevent seizures may help with symptoms of hot flashes. Treatments for vaginal dryness. Vaginal estrogen. It goes directly into the vagina. It comes in creams. It is small doses, and it tends not to increase estrogen in other parts of the body. There are some other treatments that can be used when estrogen cannot be used. Vaginal moisturizer is an option. A lubricant is. Osteopenia and osteoporosis increases after menopause. It is important to take vitamin D and calcium supplements, be physically active. I hope this topic was helpful. For other health topics, please visit my social media, Instagram, TikTok, Facebook, and YouTube. Thank you.